Hello, my name is Gillian McKee and I'm a palliative care nurse practitioner with Atlantic Health System. This series focuses on you as a person, not a patient. We know that this information can be a lot to process, which is why we recommend thinking about your or your loved one's preferences early, talking about them with family and documenting them as early as possible. Today's video will provide you with an overview of considerations related to making healthcare decisions for loved ones with Alzheimer's disease or other forms of dementia. Making decisions for a loved one with Alzheimer's disease or dementia can be difficult. While the focus is often on memory loss or their mental or physical capabilities, it's a good idea to discuss their preferences early and often because this condition can progress unpredictably. Dementia can be caused by diseases of the brain, and it affects how a person thinks and behaves. Many people do not know that dementia and Alzheimer's are terminal illnesses. They currently have no known cure, which makes it essential to take an active role in preparing to make decisions related to your loved one's care. Having a plan can help. Start by thinking about how best to have a conversation with your loved one about their care and their wishes. It is perfectly normal to be nervous. You can't be expected to know how they will respond. It may be helpful for both of you to make it a two-way conversation about what each of you wants for yourself as you talk about end-of-life care. The stage of disease that is present can help guide your approach to talking with your loved one. If it is early, you can ask a number of empathetic questions to help guide the decision-making process. Things like, what matters to you through the end of your life? What are the most important things related to your care that you want your family and healthcare team to understand? How much detail about your treatment and condition do you wish to know? How much do you want to be involved in decisions around your care? As these diseases progress and enter the final stages, there are certain circumstances that many people with Alzheimer's or dementia find themselves in. These patients often have infections that return frequently, even after successful treatment. Often they have difficulty swallowing and therefore may be admitted to hospital for something called aspiration pneumonia, which is when food or fluid is inhaled into the lungs instead of being swallowed. Treating this usually requires a lengthy stay in the hospital's intensive care unit on a breathing machine or ventilator, and medications. Sometimes artificial feeding is discussed. Knowing beforehand what to expect is helpful when planning what is important to the person, such as whether they would want to spend a lot of time in the hospital or would prefer to stay at home focusing on comfort at the end. Helping to carry out their decisions can be a challenge. It may be helpful to think about this in two ways. First, you can share who the person is beyond their position as a patient. This can help humanize your loved one and let their care team see them and understand them better. Second, you can make their wishes clear. Documenting these wishes and sharing them with family, friends, and caregivers can help provide important information if an urgent situation arises. We hope that you found this video helpful. For more information, be sure to speak to your healthcare provider or visit these websites.